Taking Care of You, an educational program brought to you by the MarinHealth UCSF Neurosurgery team. Hello, and welcome to the MarinHealth UCSF Neurosurgery Inpatient Caregiver Program, Taking Care of You video. We have created this presentation for you in order to supplement the information that you as a caregiver receive at discharge. Our goal is not to tell you everything you have to know, but focus on what the most important information and tasks you as the caregiver may need to know in the first 2 to 3 weeks after brain surgery, and give you a few tips for getting organized. Being a caregiver is challenging, rewarding, and a very important role. That said, most people are not prepared for this role, and it is normal to need some support. The role of the caregiver. Rosalind Carter once said that caregiving is universal. In fact, there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. A caregiver is anyone who provides basic assistance and care for someone who is frail, disabled, or ill and needs help. Caregivers can be family members, friends, or be hired help who perform a wide variety of tasks to assist with someone's daily life. Caregivers are often involved in one or several tasks to assist a patient's recovery after discharge from the hospital. These are some of the tasks or things you may be involved in doing after the patient returns home. Organizing and administering medications. Monitoring medication side effects. Communicating with the healthcare personnel. Assisting with physical and occupational therapy. Managing and observing the surgical incision. Becoming familiar with insurance benefits and claims, and managing the family business, legal, or financial matters. And last but not least, the very routine tasks around the home of cooking, cleaning, laundry, and transportation. Upon discharge. Prior to discharge, it is a standard protocol to instruct the patient and a family member about the medications the patient will be taking after leaving the hospital, as well as any specific instructions regarding recovery. If after discharge you feel that you have additional questions, be sure to review the materials given at the time of discharge. If questions still remain, don't hesitate to contact the neurosurgery office at 415-514-6868. Discharge Medications. It is always a good idea to have one other person besides the patient who knows or has access to a list of the patient's medications. This is for a few reasons. The main one is that if an emergency situation occurs and the patient is not able to communicate, someone needs to be able to let the healthcare team know what medications the patient has been taking. In addition, in the immediate post-op period, a patient's memory may not be 100% back to normal. It's always good to have an extra set of eyes to look over the list and make sure that things make sense. Each patient is given a list of discharge medications. Take your time to review it and make notes on the list so that you know what the medication is called, what it is for, and what dose the patient should be taking. It's always okay to ask questions. It's important to know if there are side effects from the medications and are there any that you should be watching out for specifically. As the caregiver at discharge, you will be given a list of discharge medications. It will be included with the patient discharge instructions, and it is specific for each patient. This is an example of what those instructions will look like. When you get home, you and the patient can work together to develop a more permanent medication list or log with this information. You can then remind the patient to bring it and update it at each doctor's appointment. There are a variety of ways to keep track of the medications. The simplest is to create a handwritten list. Others prefer to type the information out on their computer or their tablet. If you like your phone, there are many smartphone applications available for this task today. You will need to select the one that seems like it will work the best for you. We strongly recommend that all families use a pillbox. You can fill it alone or with the patient at the beginning of each week. Be sure to use that medication list in order to reduce errors. The pillbox also allows you to keep an eye on whether or not the medications have been taken as directed. One final tip: for midday medications, some people like to set a timer on their or the patient's phone or watch to help them remember to take their medications in the middle of a busy day. There are several medications that are commonly prescribed after surgery. They include steroids, specifically dexamethasone, sometimes anti-seizure drugs, medications for headaches, as well as medications to prevent ulcers and constipation. I'm going to discuss two of the main medications prescribed to most patients. Dexamethasone is a steroid that is prescribed before and after surgery to help decrease inflammation and swelling in the brain. Swelling and inflammation are the body's natural response to a surgical procedure and usually decrease over a few weeks following surgery. A common name for dexamethasone is its brand name, Decadron. Dexamethasone, or Decadron, can have many side effects. I'm going to mention just a few of those that cause concern after discharge. In the next few days to weeks, it would not be unusual to see some mood and personality changes, particularly increased irritability or edginess, increased appetite, extreme energy, and difficulty sleeping. These are normal and a direct and very common side effect of this medication. These symptoms should improve as the patient is tapered or gradually reduced off the drug. A patient should never stop Decadron or dexamethasone without tapering off or instruction from their physician. Part of the discharge instructions may include a calendar for how to taper off the dexamethasone. It is important to keep in mind that each person reacts to drugs differently, and that if any of these symptoms become severe or extreme, please contact the neurosurgery team right away for advice. In addition to the steroid, one of several anti-seizure medications may be prescribed. Although not for everybody, it is not unusual for the doctor to prescribe these kinds of medications in the immediate period following surgery to prevent a seizure from occurring, or for those patients who have a history of seizures. Side effects of this class of medication may include, but are not limited to, fatigue, mood or personality changes, and depression. These drugs may also impair thinking and slow reaction time, particularly when the medication is first started or the dose is adjusted upwards. Additional symptoms may include rash, hives, difficulty breathing, or swelling of the lips, tongue, and jaw. These symptoms may indicate an allergic reaction, and you should contact your doctor's office for advice, unless the patient is having trouble breathing, in which case you should seek emergency care immediately and call 911. It is important to remember that sometimes there is an adjustment period to these medications, and that some of these symptoms will improve over the next few weeks. If you are concerned about a new or worsening symptom, please don't hesitate to contact the neurosurgeon's office right away. In addition to medication instructions, the patient and caregiver will be given specific instructions about what to expect after discharge. The types of information you will receive may look like these documents. Please see your discharge summary for specific instructions and information about follow-up care. You will see in this example, we see information about what to expect, activity, diet, and care of the incision. After a brain surgery, going home can feel a little intimidating to all those involved. Please rest assured that your family member's doctor will not send your family member home until he or she is stable and it is safe. Your loved one did just have major surgery, and there are a few symptoms or side effects that you should be aware of. I'm going to review those that are expected and others that might warrant a call to the neurosurgeon's office. Headaches are a normal symptom after brain surgery and are usually related to the swelling that results from the surgery. The skull can only accommodate so much volume, so if there is swelling, it can cause increased pressure. The kinds of headaches patients experience vary by individual. The thing to remember is that some headaches are normal and should improve over the next several weeks. If your loved one is experiencing a headache, they should be encouraged to take the pain medication prescribed by the doctor. You should contact your doctor's office if the patient is taking the pain medication as often as directed and the headache is still not relieved. You should be aware that some patients who experience an increase in headaches as the dexamethasone or steroid is tapered off. If this is the case and the headaches do not respond to the pain medication, it is important to contact the neurosurgeon's office. Depending on the location or extent of the surgery, patients may go home with symptoms that they did not have prior to admission. These may include weakness, problem speaking, thinking clearly, or trouble staying awake. These may occur immediately or within the first 72 hours after surgery, and then hopefully resolve over the next several weeks. New neurological changes can also occur as a result of the decadron taper, which often means that there's persistent swelling that must be addressed. Observe if the change ebbs and flows throughout the day. Some patients do have more symptoms that are noticeable when they are fatigued. This is normal. If, however, the symptom steadily progresses or worsens, please contact the neurosurgeon immediately. The doctor will help you evaluate the taper of the decadron or other potential causes for the change in condition. There are a few things that can happen in this early postoperative period that are considered complications. The first is a seizure. A seizure is a disruption of the electrical signals in the brain and can be a side effect of the surgery, swelling, or the presence of a tumor. Roughly 30 to 40% of patients with tumors may experience seizure activity at some point during their illness. One of the scariest things to witness at home can be a seizure. A seizure may be small and involve single or multiple twitches or jerks. It can be tingling or loss of ability to speak, or what we call a grand mal seizure, in which there is loss of consciousness and body tone, followed by big twitching and relaxing muscle contractions. Seizures in patients with known brain tumors and post-surgery are not necessarily an emergency. Most of the time, a person having a seizure requires no assistance other than observation. Hi, my name is Margaretta Page, and I'm a nurse here at UCSF. I wanted to take a moment to review with you what you should do in case your loved one has a seizure. The first thing to remember is that it is not an emergency. Seizures are self-limiting, meaning they usually stop on their own and only require an observation. The next rule to remember is not to panic. This is easier said than done. You may need to say to yourself, this is not an emergency.
Once you've determined that a seizure is occurring, do your best to assist the patient to a safe position. This could be sitting or lying down on the floor or a bed. The key words here are to do your best. Clear the area around them of any sharp or dangerous objects, which includes protecting their head from bumping something. Fold a jacket or a small pillow under their head. Make sure they can breathe. Move all pillows, blankets, and clothing away from their mouths. Do not put anything in the patient's mouth. They will not swallow their tongue. Do not attempt to restrain their limbs. Stay with the patient and let the seizure run its course. This can feel like an eternity. When possible, after the seizure is over, Roll the patient on their side until they have recovered. Bend the knee and pull their arm across their body. Pull them towards you. The patient will gradually wake up. Speak softly. Tell them what happened. You had a seizure. And have them rest until they are fully recovered.
The first thing to remember is that most seizures last a maximum of 2 to 3 minutes. This can feel like an eternity. Patients having a grand mal seizure may have short periods of 30 seconds of not breathing at all and may turn dusky blue. This is a normal part of a seizure. They will then take large, snoring-like breaths and may not be responsive for several minutes. After a seizure, most patients are sleepy and may be confused, but they do recover. After a seizure, you may notice that a patient has a weakness in an arm or a leg. This is most often temporary and should improve with time. Encourage the patient to rest until they feel like themselves. It's always a good idea to contact the neurosurgeon's office to alert them to the fact that the patient has had a seizure, as a medication change may be needed. You may want to make a notation in your journal to the date and the time and the type of seizure that occurred. In most cases, a trip to the hospital or a 911 call is not required. However, there are a few situations where an emergency intervention might be needed and you should call 911. For example, if the patient stops breathing completely, if the patient has been injured during a seizure, if the seizure goes on for longer than 5 minutes, or if a second seizure occurs immediately following the first. At that point, it is appropriate to call 911. In summary, for a patient that has recently had brain surgery, a seizure is not always an emergency. Make sure that the patient is safe, can breathe, and will not injure themselves during the seizure. Do not place anything in the patient's mouth. Stay with the patient during the seizure, and as soon as you are able, roll the patient onto their side. You may not be able to do this until the seizure is over. And finally, let them rest until they fully recover. Another potential complication is a blood clot. Having surgery and a brain tumor increase the chance of a patient developing a blood clot in their legs. Although not expected, a blood clot is not unusual. If you notice swelling in the ankle or the leg, or there is pain in the leg, and usually it is one leg, not both, or you note redness on the skin, it may indicate that the patient has developed a blood clot in that leg. You should alert the treating doctor or take the patient to the emergency room or urgent care if you are unable to reach your physician. A complication of the blood clot in one's leg is that it can break off and travel to the lung. This is called a pulmonary embolism. Symptoms of this include chest pain, shortness of breath, and rapid heartbeat. This can be a life-threatening situation and needs immediate attention. Call 911 or proceed to an emergency room for an evaluation, should this occur. Lastly, as a result of surgery, a patient can be at risk for wound complications. Complications include infection at the incision site or impaired healing. These are indicated by redness, swelling, leakage of fluid, or fever. Because of the location of many of the incisions, you, the caregiver, may be the only one to get a good look at that incision on a regular basis. It's a good idea to get in the habit of taking a quick look at that incision each day. If you notice any signs of infection at the incision site or impaired healing, please contact the neurosurgeon's office right away. Now I'd like to spend some time on what to do when you get home with someone who has just had brain surgery. As I mentioned before, going home so quickly after such a big surgery can feel a bit scary. Do you have a question? it would be unusual not to have at least one. Always refer back to the discharge information given to you by the hospital team. Many of the things that you might be wondering about when you get home, like exercise, shampoo, or activity, and others, are on the sheet that were given to you and the patient prior to discharge. Be sure to place these sheets in your binder or another safe place. Discharge Paperwork. Prior to leaving the hospital, the patient will receive discharge paperwork and instructions. These documents should include the plans for follow-up with the doctor after discharge, a medication list, and detailed care instructions that will go over what to expect, activity, diet, wound care, etc. Many times people wonder, who should I call when I have a question once I get home? If you have a question about something that you feel is related to the surgery or a side effect of the surgery or the medications prescribed after the surgery, then contact the surgeon's office at 415-514-6868. If you have a question about another medical condition that the patient had prior to the surgery, for example, high blood pressure, diabetes, or a thyroid problem, we would recommend that you contact the original doctor who was treating that condition. And if you are not sure, at least in the early weeks, contact the neurosurgeon's office and they will help you decide who is the best person to handle the problem. Caregivers often wonder when they should call for help. Do not hesitate to contact the neurosurgeon's office or the nurse or on-call MD for the following symptoms or situations: severe or increasing headaches, significant nausea or vomiting, increased weakness, changes in vision, or changes in sensation, a change in the patient's ability to stay awake during the day, drainage, pain, tenderness, redness or swelling at the incision, or failure of the incision site to close and heal. Pain, redness, tenderness, or cramping in one or both calves, or leg or ankle swelling. The neurosurgery team's phone number is listed on the discharge documents. It is 415-514-6868. We know that being a caregiver can be both rewarding and exhausting. It is important to know this at the outset and that you understand that it is important, if not imperative, that you take care of yourself. As a family, you will need to decide who is the primary caregiver and who is the caregiving team. Organizing. Once you get home, getting organized will be important. The more organized you are, the more prepared you will be. You will also feel like you have more control when making decisions. Being organized helps prevent errors and allows for easy access to accurate information. One method to help with organizations is to create a healthcare binder. This helps keep you focused, organized, and feeling control, especially during an emergency situation. Feel free to create and organize such a binder in any way that works for you. Some people like to have a page just for the business cards of the healthcare team. Depending on each person and how detailed of a binder that you want, additional sections for you to consider can include a health history, a medication list, a treatment summary, a notes and questions section, insurance information, calendars, MRI reports, and additional resources and information. In addition to organizing, it will be helpful if you can take a few moments and prioritize what are the most important things to get done. You only have to focus on managing the next several weeks. Perhaps for now, focus on the next 4 weeks. We recognize that the responsibilities associated with being a caregiver described above are in addition to the roles and responsibilities that you already have in your family. Some people wonder, how on earth will they manage? One way of managing is to break the job down into small pieces. Some questions to consider are there routine daily tasks that need to get done? Who did them before, and who can do them now? Take inventory of the family roles that you and your loved one held before the illness. And ask yourself, is the patient able to continue those roles in this postoperative period? Examples of the roles that you might have held include working, taking care of the garden, meal planning, meal preparation, or perhaps carpooling the kids or the grandkids. Examples of the roles that the patient might have held might have been taking out the garbage, shopping for groceries, or managing the household finances. Delegate. You have to ask yourself, what can the patient still do? And of the jobs that he or she cannot do at this time, what additional jobs of those can you take on? Remember, friends and family members will want to help. Think which one of any of these roles or tasks might be good ones to offer to volunteers. Examples of such things that are easy to delegate include things like carpools, meals, and perhaps driving to appointments. Finally, you do have to be honest with yourself and ask, can I do this? And if you say yes, you need to think, how much can you do, and what do you want to be responsible for? Set some reasonable limits for yourself, and don't be afraid to ask for help. Sometimes you know that you just can't do it, and if you think it is not possible to be the primary caregiver, then who can it be? If this is the case, it's important to meet with your family and contact a social worker to discuss your options for caregiving. When thinking about these tasks, there are a few things to consider. What, if any, needs exist? Look at what were your loved one's prior responsibilities and what can he or she do now. You also have to ask the patient, who are they comfortable with receiving this kind of care from? This is a very important question. On a side note, one of the hardest things for caregivers is that it is very hard to plan. Conditions can change for a variety of reasons on a week-to-week, if not day-to-day basis. Most patients' conditions will at least level out, and some get stronger as they recover from the surgery. However, at the same time, there's going to be an additional burden of appointments with other specialists that may or may not be involved in treating the tumor. As a caregiver, you can try to have a plan, but at the same time, you will need to learn to be flexible and prepared to let things go if necessary. Now, back to our tasks. The next question is, who is available to help? Explore your options for help. It could be a friend or family or even hired help. The goal is to create a care team. Identify the tasks that you and the patient are willing and comfortable offloading to others. And finally, if you do think it's just too much to try and organize all of this, particularly at the beginning, it is okay to decline help. Sometimes too many people in and out of the house can be overwhelming. You may say to yourself, oh my goodness, even thinking about the jobs is overwhelming. Some people delegate this task to a good friend or another family member to help with. He or she can be your task manager and develop a system to coordinate the help from others that has been offered. A good example of some of the online tools that helps with organizing volunteers and also keeps all of your friends and family informed are Lots of Helping Hands and Caring Bridge. Use your close helpers to assist with a task like this. I'd like to close with perhaps the most important, and for some reason for most of us, the most difficult task. This is the task to take care of yourself. It's true that in order to provide the best care for your patient, you need to be as healthy as possible. These are just a few tips to get you off on the right foot. The next weeks, or in some cases longer, can be a very stressful time. You need to recognize this and prepare yourself, and do try to take care of yourself. It can and will be challenging, but there will be positive moments, and these will sustain you through the next part of the journey. Caring is like running a marathon, and you need to nourish yourself along the way. It's very important to get good habits in place right now at the beginning. Exercise. Ideally 30 minutes of moderate to vigorous exercise per day. Eat well and make sure that you get enough sleep. Take care of yourself. Make an appointment with your primary physician if you haven't seen them lately. And if you're under a doctor's care, by all means, keep up with your appointments. It's extremely important that you make special time for yourself. You need time for pleasure and self-renewal. Let yourself go to the movies, read a book, or visit with friends. Find something pleasurable and get into the habit of enjoying something each day. Try not to close yourself off to invitations from friends and relatives. At the first visit with the doctors after surgery, take time to meet with the caregiver team. And consider joining a support group for you and the patient. Additional resources. If you are finding that you still want more information, we'd like to make some suggestions. Here are a few trusted resources that we recommend. The American Brain Tumor Association, Brains for a Cure, the Musella Center for Research and Information, the National Brain Tumor Society, and the UCSF Brain Tumor Center website. This video was made possible by a generous donation to the Caregiver Program from the Christina Capurro Sand Brain Tumor Fund. We are very grateful for the donation and the opportunity to be able to provide care not only to patients, but to their families as well. I'd like to give a big thank you to the following people: Margaretta Page, Marlena Burt, Dr. Susan Chang, and Mary Destry. Without their careful review and production, this presentation would not have been possible. Hi, we would really appreciate your feedback. Please kindly take our one-page survey to help us improve this video and any other further offerings. Go to the link on the slide here, and when you're done, click the arrows to submit. Thanks in advance for your time.